Morning, everybody. Whilst we're waiting for people to join, I'll just run through housekeeping. And also, you can take the opportunity to have a look at which online persona are you. We thought we'd make it a little bit fun today. So just to remind everybody, please can you put your lines on mute and turn off your videos unless you're asking questions or entering into the discussion. If you can raise your hand to ask a question. Could everybody go on mute, please? Just stops the feedback. Thank you. Please do raise your hand if you want to ask a question, and obviously also put any questions in the chat function. And if you can introduce yourself with name, role and organisation, that just helps us to know who's asking any questions or entering into the discussion. And obviously, as always, this session this morning is being recorded. So we hope by the fact that you have joined the webinar that you consent to that. And if you, for any reason, do not want to be recorded, then please do not put on your video or ask any questions. But we hope you will be as interactive as always. OK, next slide, please. So I'm going to kick off this morning. I'm Liz Cullen, Head of Clinical Programme for Maternity and Perinatal Mental Health. For those of you who haven't met me before, we've got another packed agenda as always. So myself and Jenny will start with a bit of a national update. And then we're really pleased that Barbara Goss is going to come back to talk about staff health and wellbeing. We appreciated that unfortunately her presentation was cut short on the webinar, the November webinar, so she's back to speak to us today. Then we've got two fantastic lived experience films today. So we'll do one first of all, which is from the perspective of a new mum. Then we're going to have a presentation from Dr. Becky Lang about babies in lockdown, and then we will finish with another lived experience film from the grandmother perspective. So that's our plan for today. So before further ado, really, I just wanted to start with a great big thank you, and I wanted to put it at the beginning rather than the end, so that it has place really. Can people go on mute, please? Thank you. So it's been a really tough year for all of us, both on a professional and a personal level at different times with dealing with the pandemic. And I think I would just like to thank everybody for their continued hard work throughout this period and the care that has continued to be given to mothers, babies and families, despite everything that's going on, practices, etc. I would also like to say a really big, can I ask everybody to go on mute, please, because there's quite a bit of background noise. I would also like to say a really big thank you to my team that work tirelessly in the background that you don't necessarily get to see on the webinars, but are doing the slides, the videos, etc. So thank you for all your hard work. And when we started these webinars back in March, we thought we might run them for a couple of weeks. And here we are 9 months later and planning obviously for next year as well. So thank you to the team, to Sean, to Yvette, to Barbara, to Anita, Sarah Fishburne as well, and also a massive thank you to Jenny Walsh, my partner in crime on all of this. And then also a great big thank you to all of you for the fantastic work you do, and I hope for many of you that you will have a little bit of time out over the Christmas period, whether you are celebrating Christmas or just wanting to spend some time to have a bit of a rest. I hope you all get to do that. So thank you. Right, I will move on to the rest of our agenda. So in terms of national update, next slide, please. So I am very pleased to announce that the maternal mental health services embargo has been lifted. So that's fantastic news. And you should have received from Barbara Goss and the regional team some comms that you can share. If you haven't had that, please let us know, put something in the chat box and we'll make sure that you get that. I guess what I wanted to give you the background as to why there hasn't been a big national launch, and not surprisingly, that's because of COVID and the launch of the vaccination programme, which has overshadowed all other announcements. So the national team had been waiting, hence the embargo, in the hope that there would be an announcement. Because of COVID and the vaccination programme, that hasn't happened, but they do still hope that they will do another kind of a bit of a publicity campaign, hopefully in some point in the new year. But you are now able, if you want to use your own service, you know, Trust Media and ICS Media and that, to promote the maternal mental health services, you are now able to do that. So please do. Next slide, please. So in terms of the maternal mental health services, I think we've done very well in the South East. So of 10 early implementer sites, we have 2 of them in the South East, and of 11 current fast followers nationally, we have 3 of them. So congratulations to everybody, and for all the hard work that you did in getting your bids in, and the great proposals for the services that you will deliver for women and babies, and particularly, you know, women who also may not have babies, sadly, at the end of their journey through this period. So in terms of where we go from now, there was the national launch for the early implementers on the 25th of November. There will then be site visits happening in the new year, and we will also be working with you guys at Region to support as you develop them. You should have had your first tranche of money, and so we will go forward with this over the next couple of years, and exciting times really. So please do add, you know, use comms that you've got and share the message widely. Next slide, please. So I just wanted to give a quick message to the with regards to the Ockenden report that was published last week. So specifically looking around maternity services in Shrewsbury and Telford. But there are some key messages which obviously span maternity services and therefore include perinatal mental health as well. So there are 7 immediate and essential actions to improve care and safety in maternity services, and the maternity services are working in a very tight time frame to report back by next Monday in terms of where they're at against those 7 actions. And the one that I wanted to pull out, so I would advise you to go and have a read of it, and in particular the 7 essential actions. But what is interesting is that the maternal mental health services are mentioned within it. So they're mentioned under number 4, managing complex pregnancy, action number 4, and about linking in as we develop the maternal medicine networks, making sure that there are links into maternal mental health services so that the pathways are there. And so that's work that we will be taking forward in the next, well, imminently, but also will continue to evolve over the next couple of months. So do go and have a read of that. So at this point, I'm going to hand over to Jenny, who's going to take over.
Morning, everyone. I've just got a couple of slides I wanted to highlight to you before handing over to our wonderful speakers. So this first one is just to let you know that the free travel rail to refuge scheme has been extended until the end of March 2021. It means, I think on the back of so many increased cases of domestic violence and abuse in lockdown, this has been recognised as a something that might help women to get to a safe place. So because this touches all of you in your clinical practice, we thought it was important to highlight this. So free travel for women going in, fleeing and going to refuges extended till the end of March. Next slide, please. And then this slide was just capturing some of the things that you told us you do to stay well when we were looking at new ways of working under COVID. And we just thought it was quite important to capture the comments that you'd all shared with us in the chat box. And it actually leads me on very nicely and seamlessly to our first speaker, Barbara Goss. And if you remember, we didn't have time to do Barbara's presentation justice last time. I think it's really important that with all the COVID consequences, we really and always think about the impact on our staff. So Barbara's just going to talk to us about some of the things that are in place to help our staff with their mental health and well-being during this weird old time that we find ourselves in. So I'll hand over to Barbara.
Oh, good morning all. Yes, thank you for giving me the opportunity to continue this presentation. I was quite enjoying last week's presentation, so I was quite happy. So as Jenny said, my name is Barbara Goss and I am the Mental Health Delivery Manager for NHS. I'm going to talk a bit about the staff initiatives being implemented across the South East to help improve the psychological well-being of staff. Could we go on to the next slide, please? Oh, another one. Thank you. As we all know, 2020 has been an eventful year. In March, the World Health Organization declared a COVID-19 global pandemic. The speed and the spread of the virus overwhelmed our health systems across Europe, and the impact in the UK was significant. Our healthcare systems have been under unprecedented demand, not just our frontline staff, but every single staff group. If we start looking at the impact of COVID on our staff, the research on this is still in development. Yesterday, actually, I received a paper from Cambridge University, which was highlighting the impact of mental health and well-being of our healthcare workers during the pandemic. But again, the information is a bit sketchy at the moment, but more research is coming through, which is helping us to design the right models that will have the best impact on our staff. But although our knowledge is relatively limited, what we do know is that the lockdown restrictions meant that many of our usual coping mechanisms previously used by staff have been removed during the pandemic. So such as socialising, going to the pub with your friends and family, those kinds of almost safety nets have been removed. Results of surveys show that NHS staff at the start of the outbreak indicated that the risk of mental health and burnout was higher during this time. But I'd just like to make one point here, that if you look at all the research and data from surveys before the pandemic, they clearly show that the levels of stress and burnout amongst our staff was unacceptably high. And that was mainly due to excessive workloads and staff shortages. So we are starting from not a very good place at the moment. This is sort of reiterated by the survey done by the Institute of Public Policy and Research, which showed that 50% of our staff felt that their mental health had declined during the first 2 months of the pandemic. Another survey, quickly want to mention, was a survey actually done by the BBC, and that was done in May and June this year. They surveyed just under 1,200 frontline staff and social care staff. Staff surveyed met the criteria for either anxiety, depression, or PTSD, which is quite, sorry, I've just come up with some bad network quality, but I'm hoping everyone can still hear me. So the evidence we have recognised that the pandemic continues, that thousands of other health and care workers who may not be in frontline caring for patients are experiencing stressful and traumatic events, whether at work or at home. So there is a need for us to expand our current service and our offer so that staff who are feeling stressed, anxious, or overwhelmed can get the help that they need. Can I go on to the next slide, please? So what are we doing about this? So in the 2021 People's Plan contains 2 commitments focused on enhancing staff wellbeing. We have the psychological support and treatment, which is what I'm going to really talk about because that's the mental health side. And then we also have supporting people through sickness, and that's really owned by occupational health. What they are doing is developing pilots across the southeast, which will focus on things, got a number of key themes, which is communication, engagement, outreach, and support for vulnerable groups such as BAME. They're trying to develop a full system approach and partnership working, all to give people who are sick the support they need to get back to work in a time and fashion that suits them, and to build their strength and resilience, and also to focus on prevention. So our staff don't get to the point that they need mental health support and support. So, and one of the key things that the occupational health programme and pilot is trying to do is develop a strong culture of wellbeing across the southeast. So I think there's a big process I went through, and I think the 2 successful areas in the southeast were Hampshire, Isle of Wight and Bob. So go back to a child back in the mental health arena. So with the mental health fund, mental health hubs, funds were made available from the national team. ICS and SDP submitted their proposals detailing how they would develop hubs in line with guidance. We were successful in the southeast. All our systems were amazing, meeting the very tight timescales, and we got all 6 proposals approved, which was excellent, and I don't think any other regions managed to do that. So the investment builds on a number of other programs already put in place by providers. In our case, the model that we're using is the Greater Manchester Resilience Model, which offers staff support from qualified mental health clinicians, therapists, recovery workers and psychologists. The Greater Manchester Resilience Hub was set up in response to the Manchester Arena attacks in 2017. And the objective was to coordinate care and support for thousands of children and young people and adults whose mental health or emotional well-being was affected. The guidance that the ICS have been given to develop their hub is based around this model, although there is flexibility for them to make it more bespoke to the needs of their own staff in those areas. So the plan is for the investment will make the NHS more resilient. Mental health problems, as we have said, are the main reasons for staff sickness, and the latest data that we have shows anxiety and stress and other psychiatric illnesses account for around 28% of all sickness leave in May. So as the pandemic continues, we realise that this is going to have more of an impact. And so this is why the resilience hubs are so important. Katrina Lake, who is the Southeast Adult Mental Health clinical lead, she's worked developing a demand tool which will help systems gauge the impact of mental health, and so they can develop tools and techniques to support their staff. So it's really important to flag that there's multiple components to tackling well-being, which include improving efficiencies at work, improving staffing levels, improve communication. So the mental health team, we're working in collaboration with the People's Directorate, Workforce and OD, Equality and Diversity and Inclusion teams to embed the improvement in staff wellbeing and trying to remove some of the barriers to success of wellbeing improvements such as stigma and isolation. And key to this is addressing a culture where the belief is that self-care is selfish and being mentally and physically exhausted is merely part of the job. And that's some of the key things we're trying to tackle with this initiative. Can we go on to the next slide, please, as I lose my voice? Thank you. So the mental health hub model has sort of three key functions. There's going to be a proactive outreach and engagement function. And that, again, I said, is working in partnership with occupational health. We're going to highlight the value of mental health and wellbeing services to health and social care workforce and helping to overcome the stigma and barriers to access. And then we're also establishing and promoting a referral pathway with local key stakeholders. And as I said, this is an ICS SDP-led initiative. The second key function is how we're going to provide rapid clinical assessment. So that's including referrals from other sources such as occupational health and your GP, and identifying where further support is required, and also implementing multidisciplinary disciplinary assessments. And the third key function is providing onward referral and care coordination to deliver rapid access to mental health services. So the key part of this is to ensure staff access relevant, NICE recommended and evidence-based psychosocial interventions and treatment. And what we're very keen to ensure that all our services are doing is monitoring their staff as they progress through the system to ensure that they get good outcomes. So this will also involve signposting to IACT, for example, specialist mental health services. As an organisation, we're also trying to provide self-help resources, which we will be cascading to all the systems. Next slide, please. So, as I mentioned before, COVID pandemic is unique and unprecedented, and it's a challenge for those who are caring for people in unfamiliar and challenging clinical and support roles. There is evidence to suggest that particular staff groups may be disproportionately affected by COVID-19 and are particularly vulnerable to the effects of the pandemic. There's been a literature review led by the People's Directorate who concluded that the following staffing groups or factors may indicate a higher risk of mental health problems and consequently may be more likely to benefit from outreach and engagement and mental health support. And as you can see, it's a pretty long list. So we've got staff who've been bereaved personally from or professionally from COVID, disadvantaged group, BAME communities, etc. So you may have noticed that these groups cover most of the NHS staff, and you'd be right, which highlights why this is so important to us. So mental health hubs are planned to be delivered by December, and hopefully there's one going to be mid-January. Kent service is already up and running and is currently focused on acute staff. At the moment, we've only got funding for this financial year, but we are really hoping that the national team will have funds for the next financial year. If you can go to, I think it's my final slide, please. As I mentioned earlier, as a system, we're working to a framework, but we're also looking at how we provide new ways to make staff access the support as easily as possible. So we are currently working with Dr. Jennifer Wild, who's a consultant clinical psychologist within the Department of, if I get this right, Experimental Psychology at the University of Oxford. And her team have developed a programme, and the aim is to support staff stay well and to recover if unwell, and to continue to be able to work so they can provide much valued patient care. And this particular system is brilliant with one-to-one coaching, which is accessed via mobile. So I think I've got one more slide, which is basically a thank you. And if you need any information, please get in contact. I will be sending out links to wellbeing resources as part of the communication with this webinar. And that's it. And thank you so much for listening.
Thank you, Barbara. Such important work at this time. We really look forward to see how that pans out, and hopefully, you know, we can support multiple staff through this new model. So our next talk is one of our service user films that we discussed. What I would ask you to do for this is to make sure that you watch it and you're in the moment properly. I know what it's like on webinars. I've either done these ones regularly or been a participant on other ones, and I know the pressure that you're all under. And so what often happens is we're on a webinar and we're also answering emails or writing a report or whatever it might be. Please, can I ask you that for these lived experience films, you're properly in the moment and watch them in a mindful way and give them your attention, because they've been brave enough to share their stories with us. So I would like to introduce Bryony's story. Bryony's a new mum. Bryony hasn't had any mental health problems, and she was trying for a baby before COVID was even thought about, and ended up becoming pregnant and delivering during a pandemic, which wasn't within her plan. When we've run through this in practice, occasionally the video freezes. So what we'll do is just let the audio run on if that happens. So just stick with it. And just listen for the messages within this short film. I think there's stuff in here that will chime with all of us, and I'll let Bryony tell her own story now. Okay, so sit back and let Bryony do the talking.
Hello, my name's Bryony. I am the mum of Thomas, who's now 12 weeks old. I work for London Ambulance Service as an emergency medical technician, which means I am operational treating patients around London. When you're pregnant in the ambulance service, you're not meant to work on the road. So I started working in the office from about February 2020, quite shortly before COVID became a big issue. When COVID became quite apparent, I was told to self-isolate at home due to being part of the vulnerable group. So I worked from home on a project till the end of my pregnancy. It was quite hard working from home and being isolated. Now, when I became pregnant, I knew that I wouldn't be able to be on the road, but I thought at least I'd be in the office and I'd still get the social aspect and be able to keep up with things that are changing on station. When I go back next year, it will be probably about 18 months since I last stepped foot on station, and with such a quick turnover of staff, I think it will feel like being brand new again, having to get to know everybody and learn everything that's changed. So my husband Frankie and I found out we were pregnant before we'd even ever heard of COVID. He was able to come to my first appointment about 8 weeks, and also the first scan at 12 weeks, which was really special because he was able to see the baby and the heartbeat. Now, after that, due to restrictions, he wasn't able to come to any of the planned appointments or scans, including the scan for the baby's sex at 20 weeks. I wanted us to find out together, so I asked the midwife to write it down in an envelope, and me and Frankie opened it together in the car park and found out that we were having a little boy. Throughout my pregnancy, I did have some sort of extra checks, including a growth scan and some presentation scans, where we found out that our baby was breech. We had a failed attempt at an ECV, which actually Frankie was allowed to attend with me, which was good because I found it quite stressful. It wasn't successful, so a C-section was planned. I do wonder whether the baby saying breech was maybe down to how sedentary I was due to COVID, working from home on the sofa on my laptop and not getting out as much as I probably should have. My partner and I did find it quite disappointing that we weren't able to share all the sort of scans together, because I think that that's really special. So at this point, I hadn't really expected COVID to last very long. I guess I didn't really realise the severity of it. I thought maybe a few weeks or a few months and then we would just be completely back to normal, but no such luck. It was almost a blessing to know that what date our baby would be coming and that Frankie would be able to be there for the birth, because I've heard stories of people who haven't been allowed to have their partners there for the initial stages of labour, and then actually they've missed the main event, which would have been very disappointing. So Frankie was allowed to stay with me for the whole day for the C-section. We turned up very early, was obviously told to wear masks and keep away from other people that were there. I remember the sort of cubicle we were in, it was curtained off, but was next to the theatre where we'd have our C-section. We had to keep the curtains closed, but I could hear quite a lot going on outside. They had sort of a couple of emergencies rush past, and I think not being able to maybe see what was happening was making it quite nerve-wracking. We had our C-section at midday and it went really well. So due to COVID, the visiting hours on the postnatal ward were reduced, so partners had to leave between 8 p.m. and 8 a.m. So 8 p.m. rolls around and Frankie has to go home. Now, I've been quite reliant on him all day to help with the baby or get me water, so it was a very long night. I remember staring at the clock, wishing that time would just hurry up so that he could come back, and when the second hand reached 46 seconds it would tick back 1 second. So I was thinking that maybe time was actually further on than the clock was saying, and that he would maybe be back sooner, but he wasn't. I felt very much on my own and out of my depth that night. The support worker and the midwife popped in occasionally to give me, pain relief or check the catheter, but I really just needed help with Thomas. I remember he was crying and I just didn't know what to do, and I said to the support worker, please, I really don't know what to do, and she said, oh, maybe he needs his nappy changed. So yeah, fair enough. And then when she was gone, I realised that the nappy bag was in the corner of the room. Now, obviously, I'd had a C-section, so I couldn't get out of bed to get the nappy bag. So I really reluctantly rang the bell, and she sort of came back in and thrust this bag onto the bed and then left again. And I just felt like I couldn't ring for any help all night. If Frankie had been allowed to stay, he would have helped with all of that stuff. I don't blame the support worker. She was probably super busy. I just wonder whether anything was put in place to sort of compensate for the fact that partners weren't allowed to be there, because obviously it put so much more pressure on the staff that were working there that they had to kind of help with everything. I went home the next day. I couldn't stand to be there any longer, to be honest, and me and Frankie just have muddled through since. we were really well supported from home by the home teams, you know, the maternity support workers, the health visitor and the midwives that came out. They were just amazing. I really don't think we missed out on any antenatal care due to COVID. You know, they came in, they had to wear their masks and sort of sit on aprons and things, and it was such a shame because they weren't even allowed to have a cup of tea or a drink, and it was so hot. It was just one of the horrible sweaty hot weeks that we had in September. But they were all super professional and really friendly, and I think that they helped us through the first couple of weeks so much. After about 2 weeks, I felt ready to go out. So I met with one of my friends at a local coffee shop, which was really nice. It just felt normal.
Oh dear. Has this frozen for other people as well? Is this everybody?
Yeah, Jenny, it's
Yes.
frozen on my screen that's playing it. Let me just...
Okay. What a shame.
Do you want me to see if I can reload it again?
Yeah, we'll have a go. I mean, I think I can talk through the rest of Bryony's story because is that a good idea, Liz? Do you think it's going to be difficult to get going again?
Let me just let you do a little intermission whilst I just have a little fiddle.
Actually, it's quite a nice opportunity because there are a couple of things I wanted to talk to you all about. So next year's webinars was one of the things I wanted to say. From January, they're going to be rolled out nationally. And we're going to have 4 main themes, which we've kind of been doing, but just to highlight to you all, we've got the health inequalities theme, safeguarding, system-wide collaborative working, and the long-term plan, so focusing on each aspect of the long-term plan. And it would be really great to hear any ideas that you guys have for things that you'd like to see covered, so do chuck some stuff in the chat box. In January, we are focusing on women who've been involved with the criminal justice system in the health inequalities theme. In February, we're going to do system-wide approach, and we're going to be looking at the interface with perinatal services, maternity services, etc., and crisis teams. So if you have any best practice examples of good collaborative working between crisis teams and your own service in your area, do get in touch with us and we'll see if we can get some presentations going. Okay, Liz, how are we doing? Do we think there's a chance or possibly not?
I can get it started again, but it seems to keep freezing at that point.
Okay. Do you think it is best if I just talk about the rest of that story?
Yes, if you're happy to, and then we'll share the...
Yeah, you will get the link, so I'm hoping that you can sort of catch up. But in essence, Bryony had just said, hadn't she, that she went out for the first time to meet a friend for coffee, and then she there's a hint in the chat box, Liz, about going past that point and trying, which might be a thing.
Yes, yeah, I'll just have a go. It wasn't working, but I'll just try. I'll let you carry on talking.
Okay, so she goes out and has coffee with a friend and has a lovely time, and life starts to feel slightly more normal. And then she got a call to say that that friend had tested positive, so they were back into isolation for 2 weeks. And Thomas was very unsettled, and they struggled because a lot of the people that had been visiting, obviously as time goes on, it drops off. So she didn't have people to call on about his crying and you know what it was, and obviously first time mum found it really difficult to work it out, and actually phoned crisis helpline, which says it's 24/7, in desperation at sort of 3 in the morning when she couldn't settle him, to discover an answer phone message to say they were a 9 to 5 during COVID. So any of you on the line that are involved with third sector and doing helplines, I think if you are going to change your hours from your publicised hours, please communicate with people, because she said she'd phoned in absolute desperation, and luckily she had Frankie there as well and they could sort of share it together. But it's kind of, that might seem quite a small thing, but I think to that person who's phoning in desperation in the middle of the night, that's massive, to find that the crisis line isn't there. And she actually took him to A&E because she just didn't know where else to go with this baby, you know, getting worried as a first-time mum that there was something else wrong with him that she wasn't sort of picking up. And when she went to A&E, they were very quite sniffy with her about turning up at A&E, and the triage nurse actually said to her, "Who's the patient here? Is it Thomas or is it you?" So, you know, still some quite difficult attitudes around. I think it's really, really something that we can all think about, is just the way that we're asking questions, however stressed and busy we are at the moment, just to think about how we're coming across, because those things just stay with. And so here we are, a normal new mum and dad, their story, but everything was different because of the pandemic. And I guess that's a message for us all, that you know, we just need to be compassionate to each other at the moment, because everything's up in the air, isn't it? Everything's different. So I guess that's probably as much as you need to hear from me. We've got somebody, Helen, you're on camera, so you might want to just switch off. So I'm going to introduce our next speaker now, who is lovely Becky Lang from the Parent Infant Foundation. I'm really, really delighted to introduce Becky, who has been involved with some amazing work looking at the effect of COVID and lockdown on our babies, who actually have been a little marginalised group in themselves, I think, during the pandemic. There hasn't been a lot of support or intervention for this little group, and I think it would be really interesting for all of you on the call with an interest in perinatal mental health to hear about the work and the report that Becky's been involved with. So over to Becky.
Hello, and thank you very much for having me. Can you hear me okay? Hopefully yes. I first of all want to say thank you for that very lovely introduction, and also to say that I loved your little online persona thing at the beginning. So I am normally a waver. You can't see me, but I'm waving madly at all of you, which is what I'd do if I was in person as well. I'm also a dog owner, and literally 5 minutes ago the postman came and he went whappy, so I'm really hoping that doesn't happen while I'm presenting, so apologies. Hopefully he will stay in his bed quietly. Anyway, so I wanted to say thank you very much for having me. It's lovely to be back kind of in Wessex. I was here earlier in the year, but in person, talking about specialised parent-infant relationship teams, and so it feels very odd not being able to be in a room with you all, but hopefully you will enjoy hearing about what we found in Babies in Lockdown and what we've been doing to try and champion the needs of babies during the pandemic, as they've been rather ignored and unprioritised during the decision making and even in the road to recovery. So next slide, please. So first of all, I just wanted to give you a little introduction to Parent Infant Foundation. Apologies to those of you that do know us already, but for those of you that don't, we're the only national charity proactively supporting the growth and quality of specialised parent-infant relationship teams across the UK. These are multidisciplinary infant mental health teams that work with families experiencing severe, complex or enduring difficulties in their early relationships and where babies' emotional well-being and development is particularly at risk. As an organisation, we have a unique role in bridging the gap between frontline delivery, local commissioning and national decision making. Next slide, please. And through collaborative leadership, oh no, back one, that's it, thank you. We grow more parent-infant teams and support the sustainability of those that already exist. We work with teams to improve the quality of what they're delivering. We generate evidence to create a compelling case for further investment in teams, and we campaign at national level on behalf of babies and their families. We also provide the secretariat for the First 1,001 Days movement. Oh, does somebody need to say something? Okay, which is an alliance of over 160 organisations that work together to drive change by inspiring, supporting and challenging national and local decision makers to value and invest in infant mental health. And you can find out more about the First 1,001 Days and also us as an organisation on our website. Next slide, please. Okay, so today I'm going to focus on babies this year during the pandemic. I'm specifically going to do a brief mention of the headlines we've seen in the media, talk specifically about the babies in lockdown report we published in the summer and the policy asks that we called for, a snippet of some further work that we'll be sharing the results of in the new year, which is some further work on babies and the decisions being made at local level, and also the ongoing policy and campaigning work underway to keep babies on the political agenda. Okay, next slide, please. Next slide, please. That's it, thank you. Since March, we've been alert to the huge range of issues affecting babies and their families, whether that's limited face-to-face support for antenatal and postnatal visits, the impact on maternity services and the birthing journey for women and their partners. And we heard an example of that from Bryony just a moment ago of how the pandemic has been affecting that. Impacts in homes such as domestic violence and the worries around increased safeguarding issues and abuse and neglect in young children. We've also been aware that all these issues are likely to have had the most impact on those already vulnerable. And essentially, as need increased for families, support felt like it decreased, and concerns were raised even back in March about the potential risks for families and their babies as vital services changed. And there were concerns not only about the stresses on families as a result of job losses and increasing poverty, but also the practical elements of being together for the birth or when babies were sick and hospitalised, or indeed the impact of social settings such as playgroups and childcare having to close their doors. Next slide, please. And sadly, as the year progressed, these concerns that were raised early in the year were realised in many areas, and we saw reports turning to the impacts on babies directly, with increasing safeguarding issues and sadly increased deaths. Next slide. So the Babies in Lockdown report was published in August this year. Next slide. And as charities that exist to support families, parents and children, Best Beginnings, Home Start UK and us at the Parent Infant Foundation were alarmed that the voices of parents and new babies had been absent from key pandemic responses. The three national charities, all leading organisations in advocating for parents and babies, commissioned critical research to work with us to gain insights into the impact of COVID-19 on babies and their parents of all backgrounds from across all 4 nations of the UK. An online survey was developed, and that was circulated between the 29th of April and the 3rd of June. and contained a mix of closed and open-ended questions to allow families to share with us as much or as little as they wanted about their experiences. We made particular efforts to reach parents from seldom heard communities, including trialling the survey with parents, a diverse group of parents, before its launch, and worked purposely to ensure that our data represented the experiences of a broad range of voices, not usually represented in research, such as same-sex, Black, Asian and minority ethnic families, single parent and low-income families, as well as those where English isn't their first language. And to do this, we collaborated with diverse influences and community connectors, seeding the survey out from these individuals to try and make sure we also captured the voices of more marginalised families. Okay, next slide, please. Over the duration of the survey period, we gathered 5,474 responses. The qualitative and quantitative findings captured the experiences of a cohort of babies and their families under circumstances such as we've never seen before. The findings built a complex picture showing wide regional variations, inequalities between different communities, and the emotional rollercoaster and challenges that parents have faced. A total of 373 parents from Black, Asian and minority ethnic communities completed the survey, which as a percentage of the total survey wasn't fully representative. However, despite this, their voices did come through loud and clear in both the qualitative and quantitative findings. And we had a range of responses from across the first 1,001 day period, including 1,480 pregnant women and 91 of their partners. 800 of those gave birth in lockdown, and then just under 4,000 parents of babies under the age of 2. And the survey focused on the following key areas: the impact on babies, the impact on parents, the impact on care and support that they received, the effect for key workers, and it was interesting to hear Barbara's talk earlier about mental health across key workers generally, and I'll be talking a little bit about those who were pregnant or parents of young children. And just to say that the report goes into a lot more detail than I'm going to share here, and so this is just a headline of some of the rich experiences that we heard from families. Okay, next slide, please. So the impact on babies. Just over a quarter of the parents in our survey were concerned specifically about their relationship with their baby, and of these, over a third would have liked to have got help with this, and this was seen across both parents and parents-to-be. We were interested to learn more from our survey respondents about the lockdown and consequent changes in families' lives on babies. And many respondents felt their baby's behaviour had changed because of the lockdown. We heard how babies crying increased during this time, and a third believed that their baby's interaction with them had changed. Next slide, please. Our findings demonstrated that groups already known to be at higher risk of poor outcomes, such as low-income families, young parents, and those from Black, Asian and minority ethnic communities, were more likely to have a difficult experience of lockdown. Our survey showed that households with an income of under 16,000 were significantly more likely to report an adverse effect on their baby's behaviour during lockdown, with 2/5 of respondents in this bracket saying their babies cried more during lockdown, compared to almost a third of respondents in the next highest bracket. And similar variations were seen when we looked at the data by age of respondent, with the youngest feeling that their babies were crying more than usual, not far off double the number of those in the oldest age bracket expressing this. Next slide, please. We wanted to understand how parents have been experiencing this time. Over 2/3 said that their ability to cope had been affected by the restrictions. For some respondents, the lockdown brought advantages such as increased time at home and the presence of fathers and other co-parents. However, for many, the time was one of very considerable stress, with exacerbations of usual worries during birth and entry to parenthood manifesting into severe and unacceptable experiences for some. Overwhelmingly, our respondents were concerned about COVID-19 and the lockdown, with almost 9 in 10 feeling more anxious as a result. In addition to the concerns affecting all of us, expectant and new parents had concerns about themselves and their babies, born and unborn, just as their usual support of family, friends and health professionals and community services were not available to support them to navigate the choppy waters of early parenthood. And Bryony shared that beautifully in her narrative. The overall trend in the data showed that fewer parents experienced anxiety as income increased, with over half of those earning the least reporting feeling a lot more anxious compared to 1/3 of those earning the most. A similar trend was seen across parents of different ages, with younger parents experiencing a lot more anxiety. Next slide, please. We asked parents, respondents to indicate their main concerns during lockdown, and parental mental health was the top concern across the board. We already know that around 1 in 5 women and 1 in 10 men will experience a mental illness in the perinatal period. Research shows that 7 in 10 mothers will underplay the severity of their feelings, and stigma remains a very real barrier to parents speaking out about their mental health at this time. And very many more than this will suffer levels of distress that will not reach clinical thresholds. And in our survey, 1/4 of pregnant respondents cited mental health as a main concern, said that they would like help with this, rising almost to 1/3 of those with a baby. However, fewer than 1/3 respondents overall were confident that they could find the right help if they needed it. We also did see some variations by ethnicity, age and income regarding main concerns, with issues such as financial and housing worries, as well as mental health concerns affecting those on low incomes and younger parents. Next slide, please. In the space of a few days, as lockdown began, the landscape of professionals and services supporting families at this crucial time of their lives changed. Most appointments switched from face-to-face to telephone or online. The regularity and frequency of routine appointments changed. Fathers and other co-parents were no longer able to attend appointments or the early stages of labour, and traditional social support and services became differently accessible. Some areas saw up to 4/5 of health visitors redeployed elsewhere. The experiences of parents and the care, support and information they sought and received varied hugely across the country. With over 1/3 of those who gave birth during lockdown stated that the care at birth was not planned. Depending where they lived, this varied from around 1 in 5 in the southwest to 3 in 5 in the West Midlands not receiving care as planned. And there were concerns about receiving reliable pregnancy information, and once the baby was born, few saw their health visitor face-to-face. Next slide. Throughout the report, we reflected the real experiences of families by sharing their responses to highlight some of the themes that emerged. The following slides share a tiny fraction of the responses we received and the comments that we had from parents. So do feel free to go and dive into the report to read more, to really feel the breadth of experiences that families went through. The lockdown restrictions, as we heard from Bryony, meant that exclusion of fathers and other co-parents at antenatal appointments happened, and again that differed variedly across the country. As we heard, Bryony's partner was able to attend some of her scans, but for some areas of the country this was not feasible at all. And there was absence from all or most stages of labour. And due to the substantive reduction in midwifery appointments and antenatal classes, as well as parents not being able to visit their hospital, fathers and other co-parents have had significantly reduced opportunities to participate in important parts of the pregnancy and birth journey. And together these can disrupt bonding, placing strain on couple relationships and likely increasing the risks of developing mental health difficulties. Next slide, please. Among our respondents, most said they would turn to family and friends for additional support, and the loss of this support was felt acutely by many. As had been highlighted earlier, there was a lack of confidence in accessing mental health support, with only 1/3 of respondents feeling confident about being able to access if it was needed. And it's notable too, though unsurprising, that parents with babies felt less confident in accessing practical support. People in the lowest income bracket felt less equipped with the information that they needed. Next slide, please. We asked respondents whether they were feeding their infant in the way they had planned and whether they had received the breastfeeding and the support that they needed. We also invited them to tell us more about their experiences if they wanted to. And again, the survey revealed very varied experiences geographically and for individuals. Over half of all postnatal mothers were breastfeeding at the time of the survey, and over a quarter of women stated that they did not have the support they required with breastfeeding. In our survey, over half of those exclusively formula feeding had not planned to do so. And in the South East, this figure rose to 60%. And as the quotes show here, the lack of support has contributed to the negative emotions that I reported on earlier. Next slide, please. And there was very real concern about financial stability as parents and parents-to-be were losing work, being furloughed or becoming sick themselves, and the very real effect this would have on their family's ability to cope and stay afloat during the pandemic. It was such a time of uncertainty with regard to employability and with different businesses and sectors closing or not throughout the lockdown period. And dads especially reflected on the pressure felt at this time, and these concerns were definitely significantly higher for those in low income brackets, with younger parents and those from Black, Asian and ethnic minority groups as well. Next slide, please. While it's clear what the rationale is for switching from face-to-face to digital consultations, the emotional impact for mothers receiving care in this way must not be underestimated. Whether it was being helped with breastfeeding via video and the discomfort of filming a baby trying to latch onto the breast, or the experience of seeking medical help for an infected wound after birth, the mothers in our survey made clear how difficult this was for them. And this quote highlights the very difficult challenges some women had to endure. Next slide, please. Barbara talked earlier about the mental health concerns and worries about frontline workers across the board in her presentation earlier. And in our survey, nearly half of NHS, social care and other healthcare staff who were pregnant or had young children were concerned about staying safe at work. One of the very concerning findings from the survey was the way in which those who were pregnant and therefore deemed to be vulnerable, who were also essential workers, found themselves caught between pressures to work and a desire to protect themselves and their babies. Within the survey, we asked respondents to tell us if they or their partner worked outside the home, and our survey respondents included 451 frontline NHS social care or healthcare roles, 230 non-healthcare roles with contact with the public, 302 with a partner in frontline NHS or social care roles, and 986 with a partner in a non-healthcare role but in contact with the public. And understandably, given the way the pandemic was affecting different groups, NHS workers from Black, Asian and minority ethnic backgrounds expressed additional concerns relating to the increased risk which they felt they were being exposed to and the lack of support for this. Next slide, please. The survey asked people which 3 words best described your mood over the last 5 days, and most of the words given were negative: anxious, tired, low, stressed, frustrated, all the things that we've heard throughout this. However, happy was the second most common word for word number 1. And I wanted to share this because there was a very mixed experiences during lockdown. It was absolutely right that we highlighted the very significant negative effects that families and babies experienced during this time. But we mustn't forget that for some, actually the lockdown brought some advantages as well. The slowed down pace of life for some was welcome. Some services, especially once things went digital, saw more presence of fathers and co-parents at appointments, digital appointments and things like that. And some did have some very positive experiences of care and birth and in the postnatal period. Next slide, please. However, for many, the time was one of very considerable stress, with exacerbations of usual worries during birth and the entry into parenthood, manifesting into quite difficult situations. And COVID-19 has affected babies, parents and the services that support them in hugely diverse ways. And the findings in this report demonstrate the impact on different aspects of families' lives. And we highlight, in the report where there's been significant differences between particular groups as well. But what is evident is that this pandemic did not affect families equally, and those already experiencing adversity and challenge were more likely to see this exacerbated during lockdown. Next slide, please. This is just a link to, if you want to have a look at the report in more detail. There's also other information on there that's come out of the survey and some of the activities that we've done around campaigning as well. Next slide, please. Just wanted to take a moment to share some new findings that we've had from a secondary piece of work that the Foundation's been working on with research partners ISOS. Next slide, please. So separately to the Babies in Lockdown survey, which focused on raising the voices of families and their babies, we have been conducting another piece of work which has been exploring the experiences of practitioners and decision makers at local levels who work in the 0 to 2 period. And this piece of work will be published mid to late January. And so I'm just simply providing a little snapshot here to kind of add to what I shared from Babies in Lockdown. And the key message is really very little from what we heard from families. You know, many had seen parental mental health impacting on bonding with their babies. Play and stimulation had reduced. What they were seeing when they were with parents had reduced, and this was impacting some of the babies that they saw. The lack of direct contact with essential services was risking poor outcomes in families. And certainly in parent-infant work, we found the digital work quite challenging to be able to really see the baby. As an example, family income was affected, and this in turn was increasing the risk of food poverty, and exposure to domestic conflicts, child abuse and neglect has increased. And you'll be able to hear more about that in the new year. Next slide, please. So with all these findings, what have we been doing about it? You know, it's been shocking to hear just how families have been affected, and but the crisis has exacerbated and illuminated issues such as the gaps in services and care for families during pregnancy, as well as the inequalities and early experiences and outcomes. But many of these problems existed before the pandemic, and what has happened is really we've seen an exacerbation and families affected even more acutely than before. Next slide, please. So in our Babies in Lockdown report, so on the back of the experiences that we heard from families, we outlined some very specific asks. So we know that sustainable investment in the support structures for babies, children and families is long overdue. And we must, you know, we must not only restore depleted services, we must also harness the voices of parents of all backgrounds to find new solutions, innovate and build systems of support that can deliver to their needs and the needs of their children, both now and beyond. It provides potentially an opportunity to see change that is so desperately needed. And we want there to be sustained and thoughtful investment in public services, charities, communities and families to enable post-COVID-19 rescue, recovery and repair. And we want to see a building of support and services to enhance the caregiving capacity of parents so that all children can receive the nurturing care they need and can thrive and not just survive. And as a result, we propose 3 specific fiscal measures to address the unique needs of this cohort of parents and babies to drive lasting change. The first one was a one-off baby boost to enable local services to support families who had a baby during or close to lockdown. The second, the parent-infant premium, was to provide new funding for local commissioners targeted at improving outcomes for the most vulnerable children. And that was based, the background to that was based on the similar model to the pupil premium that you see in slightly older children. And then the third is around significant and sustained investment to support families from conception to age 2 and beyond across statutory services, charities and community groups. And what we did was we focused on the one-off baby boost just ahead of the comprehensive spending review, which was a few weeks ago now. Sadly, it had literally no effect. Rishi didn't mention babies once, which was incredibly disappointing. And so we are continuing to push for the parent-infant premium and the significant and sustained investment that we were doing before. And that will continue into the new year and beyond. Next slide, please. One of the positives that's come out of the crisis is that it's catalysed some really fantastic work between charities in the sector. So although the Babies in Lockdown work was a coalition of 3 charities, We have worked with partners across the whole of the First 1001 Days movement on a range of public and private policy work on issues such as health visitor deployment, outreach for vulnerable families, virtual service delivery, funding, and the separation of mums from their partners and babies from their parents in hospital settings. Some of the issues we saw were very specific to COVID, the lockdown and the policies adopted to reduce transmission, and some were symptomatic of much bigger systemic issues. And we remain committed to raising the voices of babies and their families at local and national levels to see change. And if you're interested in doing so the same, please do visit the website to find resources that can be useful for you too in terms of your local conversations. Next slide. And that's been done. Thank you very much. I'm happy to take questions and answer what I can.
Becky, thank you so much. Gosh, that's food for thought, isn't it? There's so much in there. And really interesting how it chimes with what we'd already heard from Bryony. And also, fingers crossed that we okay with the film. We've got another film coming up from the grandmother's perspective, and I think there'll be other things in there that also chime with it. Do you mind if I ask that any questions go into the chat box, Becky? Are you able to hang around to answer them?
Yeah, that's not a problem. And I can see a couple of comments around you know, the impacts. You know, I think one of the things from the pandemic that I probably maybe didn't share well enough was actually this is what's been happening now, but we are absolutely anticipating an ongoing impact on these babies and their parents for some time to come. And I can see a comment from Jenny, from you, Jenny, sorry, about the potential tsunami to perinatal mental health services, and we're certainly feeling the same in terms of parent-infant relationship services as well. And of course, there's significantly less of them around the country. And I think other support services, well, already we're seeing an increase in referrals. And I think that as the difficulties become entrenched, I think you're right. We're going to see much bigger referrals and long-term impacts here.
Yeah, and whether there's any sort of longer-term impact on the babies as well.
Yeah, absolutely. And I think we probably won't see those for some time. You know, it'll be in the preschool and early years pick-up time that some of that might not get identified, which is really worrying, because of course we know in these early months and years is a real time for, you know, setting the foundations for social and emotional well-being, and you know, we'll have to see what pans out.
Yeah, well, thank you once again, Becky. That was amazing, and I think for everybody who's attended today, there's going to be something in there for all of us, whatever discipline we come from. So thank you. So now we're going to go on and finish with Elizabeth's story. So Elizabeth is a grandmother. Her daughter had quite a serious mental health problem, so she's going to talk to us about that from a very different perspective here, but I'm sure it's one that you'll find interesting. And everybody keep your fingers crossed for the film, because it feels like the day of technical difficulties today. So fingers crossed that this one works. Okay, I'll hand over to...
Hello, my name is Elizabeth, and I am the mother of 2 grown-up children and a little grandson who is 19 months old. The perinatal team asked me if I would talk about how having a daughter with mental health issue, how COVID has impacted on that. Firstly, I must say that I myself was recovering from a mental health issue earlier on in the year, and I was in recovery just as my daughter was obviously needing support from me. This was also on the cusp of COVID, just on lockdown. And it was quite evident that she needed me to be there with her in her home. So that's exactly what I did. I went down and camped out in her spare room, leaving my husband to sort everything out here. It's only half an hour's journey from where we live, but that was the only way I felt we could sustain it. I needed to be there all the time. My son-in-law was working from home. He could not care for her or his son. I just had to be there. When I made that decision, I was met with criticism from friends and a family member saying things like I was breaking the law. They couldn't see their grandchildren, so why was I doing that? You know, going down and looking after my daughter so that I could see my grandson. I was very hurt. It added to the pressure that was on me. I just had to realise it was some people just don't.
No, not again. So, Sian, I believe you're on this one. What's our chances?
I don't know. I'm just looking now to see if I can restart, but it's not looking good.
Oh, I'm so sorry to everybody on the call. I do know this story because I've watched the video and I chatted to Elizabeth about the sort of things that might be really interesting to hear. So just looking at the time, I wonder if it's worth me filling in by just telling you what happened.
Yeah, I think so. It's taking a long time to download.
Okay. So Elizabeth was 67. She was having to do all looking at the house for her son-in-law and daughter. So she was sort of housekeeping and childminding and keeping her daughter safe as well, because her son needed to work from home, and a lot of people that he worked with had been furloughed, so he had extra pressure of taking on other people's work as well at home. She found the pace of it really hard, and her son-in-law was actually working out of the bedroom that she was staying in, so she had to obviously be up and at 'em quite early with the baby and vacate the bedroom. So, you know, it wasn't a massive house. There were all of those issues, and she was cooking and doing laundry and all of that stuff. So it's incredibly tiring. They were very isolated because they were so fearful of any one of them catching COVID, and then the whole sort of house of cards come tumbling down. So
Jenny, I'm
yeah.
really sorry to interrupt, but we're just going to try. Yvette is going to see if she can share it on hers.
Oh, okay.
So sorry to stop you mid-flow.
No, that's fine. I'd much rather people heard it from Elizabeth. So let's go.
I'm not quite sure where we're up to either, so I'm going to press play and see what happens. Fingers crossed.
Asked me if I would talk about how having a daughter with mental health issue, how COVID has impacted on that. Firstly, I must say that I myself was recovering from mental health issue earlier on in the year, and I was in recovery just as my daughter was needing support from me. This was also on the cusp of COVID, just on lockdown. And it was quite evident that she needed me to be there with her in her home. So that's exactly what I did. I went down and camped out in her spare room, leaving my husband to sort everything out here. It's only half an hour's journey from where we live, but that was the only way I felt we could sustain it. I needed to be there all the time. My son-in-law was working from home. He could not care for her or his son. I just had to be there. when I made that decision, I was met with criticism from friends and a family member saying things like I was breaking the law, they couldn't see their grandchildren, so why was I doing that, you know, going down and looking after my daughter so that I could see my grandson. I was very hurt. It added to the pressure that was on me. I just had to realise it was some people just don't understand how difficult mental health problems can be, to live with them, having to deal with them. So as I say, I made the decision, moved in with my daughter, moved into a spare room, which was also my son-in-law's temporary office because he was working from home. He could not be involved in the day-to-day caring until the evenings because he was very, very pressured with work because colleagues were on furlough, so he was having to take up a lot of work that they would have been doing. It's very difficult for him at a very difficult time with his wife. As I say, we're all very close as a family. I have a very good relationship with my son, and our main aim, and my husband's aim as well as my son, was to make sure that my daughter was cared for and that my little grandson was nurtured, loved, stimulated, secure, which I think we gained because he's a perfectly well-adjusted little boy now. When I talk of my family, partly that has been affected by COVID in the respect, right from the beginning, my mantra had been that we must stay safe as a family. Everybody else is trying to be safe, but we have to be extra safe. Because if one of us becomes ill, then the whole structure falls down. How can we care for my daughter and grandson if one of us is ill? It just wouldn't have happened. And part of this was I haven't seen my son since February. He lives in Nottingham. He decided right from the beginning that he was not going to come anywhere near us. Even when lockdown had finished, he said he would never forgive himself if he gave us COVID, if he was the one responsible. So until this day, I've not seen him. I'm hoping that we'll be able to see him in the next few weeks. So that's a side of COVID that perhaps is hidden. Right. So I'm living with my daughter. Everything, as we know, overnight came to a standstill. Everything stopped. All the support from professionals who was fantastic at trying to maintain the best support they could through other means. It's just not the same as having that face-to-face contact. Indeed, me sitting here, looking into a screen, looking at myself, not knowing who I'm speaking to, is very, very alien. I just am very much a person who needs to see the person before me, somebody I can relate to, somebody I can speak to, a friend to have a hug, and none of that was possible. And that was the same for my daughter. She was unable to meet up with friends, not that she was well enough to begin with, but afterwards it was very difficult. All the little groups that she went to beforehand were no longer available. So anything to alleviate the tedium of being in the home and trying to find things to make your own well-being, mental well-being better, were just negated overnight. So it was trying to be a bit creative with that, and that just didn't always happen when we were so tired, because it was relentless. my grandson and my daughter. With regards to things like health visitors, my grandson's first checkup was a telephone conversation with a tick sheet, and there were some anomalies, and young mums, first-time mums, always need that reassurance, and no reassurance from me that he was hitting the milestones, maybe some a bit later, some a bit sort of sooner, and that he's a well-adjusted boy. Didn't really help me saying it. You needed other people to say it, and I thank goodness the nursery nurse from the perinatal team was the one person who my daughter really respected her opinion, and she was able to alleviate some of these problems. Other things that you know, I was a grandmother having to learn things. It was a big learning curve all of a sudden, having to look after a little one after so many years, and we getting support when he was supposed to be moving back to having dairy, not instead of the special formula he'd been on, and that was difficult because, you know, I was trying to do one thing and Emily wasn't sure, and it's very difficult to speak to people, to get hold of people. So that made life difficult. All these things that just, nothing was easy, nothing was spontaneous. Yeah, it really was just about keeping my family safe. I mean, eventually, probably towards August, we did manage, well, July, August, we did manage to sort of go further afield and have days out sort of in the New Forest and on isolated bits of coast. So thinking about this, you know, has COVID made the situation we were in even worse? On balance, I would have to say yes, because accessing things were far more difficult. For any young mother, it would have been difficult. One who is suffering with stress and depression and anxiety, it just made life even more complicated. There is so much more I could say, but it is 10 minutes. The joy in all this has been able to see my daughter start to live her life again. And of course, the joy of seeing my grandson reach all his milestones, his firsts, walking, saying words, being funny, you know, just the joy that not every grandmother has if they don't have that close relationship. I wouldn't like to, I would have wished it hadn't happened this way, but it did. And I have to hold on to the fact that we've got through it with the help of the wonderful perinatal team. And I can't thank them enough that they have supported my daughter and all of us. Me, picked me up at a time when I felt at a low ebb. So thank you. And I hope this has given you an insight in some of what's happened in my life. And I managed to get through without crying. Thank you.
You're on mute, Jenny.
That's £5 in the charity box. I haven't done that on a webinar for ages. I was just saying, isn't it lovely to hear from the grandmother's perspective? You don't very often hear from that perspective, and I did find that very moving. We're just a tad over. We do have just a couple of slides. This was what I was talking about earlier about any good practice examples of collaborative work between perinatal and crisis teams or maternity and crisis teams would be great. And then I think we had another one with we've got the dates for next year, and I think people on the distribution list have received those. Another reminder of January, women involved in the criminal justice system. Massive thank you to all of today's contributors. And I think there's one more. Is there one more? Just a reminder about sharing the slides, and we have a new email address. Liz, I'll hand over to you.
That's perfect, Jenny. I don't think I've got anything to add. Just to say, yes, do look out for future comms will be coming from this new email address. And for the specialist services, there's also a webinar workshop on the 13th of January, which is around the access target. So you'll have already received a invite to that, but that's for specialist services specifically targeted at them. So I guess without further ado, it's just for Jenny and I and the rest of the team to say thank you very much for attending all the webinars this year, and we look forward to seeing you in 2021. Thank you very much.